Hi, I'm Dr. Andrew Williams. I'm the medical director of the Community Health Center of the North Country, and I've been up here for 10 years and looking forward to being here for the rest of my career. When I came up here 10 years ago, it was very clear that the North Country was a community that had a large population of people who were medically underserved, so people who didn't have access to the kind of care that they needed. So I thought it was a nice opportunity for me to make a difference. I also have family in the area, so I have an identical twin brother who's lived here for 20 years, and I wanted to live nearby him so we could raise our families together. Federally qualified health centers play an important role in delivering high quality medical care to communities. They're found in urban areas where there's a shortage of health professionals, but also in rural areas, particularly like the North Country, where we have a large population of people who usually doesn't have good access to high quality care. These are folks who end up relying on emergency departments for routine medical problems that could easily be taken care of in a primary care setting. We have a model of care where we establish each individual patient gets their own primary care provider, whether it's a physician, a nurse practitioner, or a PA. That provider gets to know the patient and gets to see them over time, see them develop if they're a child, see them age if they're an adult, and provide compassionate care to them over a period of time and to be available for them. So one of the things we pride ourselves on as an FQHC and a community health center is providing what we call patient-centered medical care. So the number one focus is on the patient, but it's not just the provider who's delivering the care, it's a care team. So from our front desk staff to our nurses to our referral coordinators, along with the provider, we look at the patient as an individual, but we provide the care as a team. And that way, if a patient has a need, we make sure the need is met by the right person and that we can meet the need as quickly as possible. Health centers are uniquely positioned to provide a patient-centered medical home that I discussed earlier. There's, I think, a movement toward a model of what people call advanced primary care. So making it so that patients, when they become ill, really have an option to get care in an outpatient environment by a provider who knows them and cares about them as an individual, but also as part of a family. We at the health center try and provide comprehensive care. So if somebody has a medical issue, we address that. But if they have a dental issue, we can also take care of that. Physical therapy services, eye care, mental health services. So we really like to see ourselves as being in a position to provide high quality care, not just primary care, but comprehensive care to meet most of the needs that patients are going to have. And then we've really worked as a healthcare center to develop strong relationships with a network of specialists. So if a patient does have a problem that's sort of beyond the scope of practice of a primary care provider, we have very good relationships with local specialists and regional specialists, so we can continue to coordinate the care even if it's being delivered outside of the health center. So I think it's a great model of care, and I think actually as the healthcare system evolves, you're going to see more of an emphasis on healthcare centers in recognition that this is a good way to practice medicine. I think without community health centers, you'd find a whole segment of the population that was forced to receive medical care that's inadequate. People would not receive preventative services. So you'd see severe illness, including cancers that are diagnosed in a later stage, where the opportunities for treatment are often missed, or the treatment options that are available are more aggressive and have more morbidity associated with them. I think you'd see a lot more patients who ended up in emergency departments, getting care basically in the wrong environment. Emergency departments are great places if you have an emergency, but if you have a relatively routine chronic illness, it's not a good place to receive care. So I think if health centers didn't exist, you'd see people in the community really suffer. I think it would be a huge setback. There's no doubt in my mind that establishing a relationship with a primary care provider is very beneficial for people's health and long-term, health outcomes. I think if you have a chronic condition, it's certainly important to have a provider who can manage that in continuity over time. I think even if you don't have an acute illness now or a chronic illness, seeing a primary care provider who can provide the preventative services, so colon cancer, breast cancer screening, cervical cancer screening, those are all examples of diseases where it's been proven that if you can detect them early, you can treat them in a much less invasive manner. Chance of people having, surviving and thriving the rest of their lives if they've had that cancer detected early, it's very, very convincing. If you just get your care in an emergency department, you're not going to get screening for these diseases.
At Community Health Center of the North Country, it's not about insurance or ability to pay. It's about the access to care Dr. Williams just spoke about. And for over 40 years, we have been serving the Canton, Gouverneur, and Malone communities. Our team looks forward to providing even more access to care by opening our new location in Ogdensburg soon at 102 Fort Street. Thank you for choosing us for your family's healthcare needs. To find out more, please visit chcnorthcountry.org.